Amazing grace, how sweet the sound. 我罪已得赦免。
Fui ciego, mas hoy miro yo.
Perdutor salvo soy.
So much has changed in our world lately.
疫情中这么多人失去生命，显明了生命的脆弱与短暂。
Pero la asombrosa gracia y amor de Jesús es más fuerte que la vida y la muerte.
Wo auch immer du bist, ruf seinen Namen an. Jesus.
Jesus.
Jésus.
Isa.
Isa Masih. Jesucristo.
Yeshua. Jesus.
Don't wait another day.
Mga kababayan, ang pambansang awit ng Pilipinas.
Kayang magiliw, helas ng sinakanan, alam ng puso, sa titik mo'y buhay. Lupang hinirang, tuyag ka ng magiting, sa manlulupin, di ka pasisingil, sa nagatang tutok sa simoy at sa langit kong pagaw, ay hinatang tulakaw. fought for our freedom, and her men and women bring her fame. That's the province we'll cherish forever, whose glory we will treasure and proclaim. There is peace o'er the hills and the valleys, there is joy amidst the verdant plains. That's the place we call our own, Ilocos, our beloved home, ever ours, forever we may roam. Ilocos, the land of the free, home of men strong in faith and unity.
We the people, courageous, bright and fair, dedicated to strive and totally care.
Ilocos, with your light to guide us, we will never fade. Where the brave heroes fought for our freedom, and her men and women bring her fame. That's the province we'll cherish forever, whose glory we will treasure and proclaim. There is peace o'er the hills and the valleys, there is joy amidst the verdant plains. That's the place we call our own, Ilocos, our beloved home, ever ours, forever we may roam.
Good day to each and everyone. Learning in the new normal is a challenge for teachers, students, and even parents. The new way of learning brought about by COVID-19 pandemic gave an additional challenge during this tough time, and going back to the normal isn't going to happen yet. We must adjust to this current situation. Without further much ado, let me welcome you to this first anticipated event of the Health Science Department, the virtual orientation program for the school year 2021-2022. To start with, let me introduce myself to you. I am Mrs. Joyrena Refuerzo Ragasa, your virtual host for today. To start with, the orientation proper will be the presentation of the vision, mission, goals, and objectives by our Health Science Department Program Head, no other than Mr. Limuel V. Dolorico. Let's give him a virtual applause.
Good day, everyone. This is the Health Science Department Vision, Mission, Core Values, Goals, and Objectives. The Health Science Department envisions that by 2030 will be a premier institution producing globally competitive healthcare professionals to ensure the health and welfare of the people through the provision of quality education and equitable resources. Our mission is to provide equitable industry-based education to develop the Ilocano youth in becoming stewards of health through an outcome-based approach anchored on quality instruction, research, community engagement, and industry-based partnership. The following are the core values of the Health Science Department. Ilocano industry. We remain grounded in our Ilocano roots. We recognize the value of hard work in achieving our objectives. Scholarship. We are committed in fostering the professional and personal growth of all stakeholders and the promotion of lifelong learning. Community relations. We work collaboratively with one another and engage responsibly with the communities we serve. We develop and implement programs that are reflective of the institution's reason for existence. Cultural sensitivity. We cultivate a conducive environment that celebrates individual differences and encourages mutual respect, effective interaction, and meaningful working relationships amidst cultural and religious diversities. In terms of goals, the department is directed towards localization through responding to the current needs of the local and global community. Holistic student development. We aim to promote multi-dimensional approach to hone students' knowledge, proficient skills, and inculcate desirable attitude. strategic community engagement, and industry partnership to develop programs and services that promote progressive social transformation. Our objectives in terms of instruction are the following. The syllabi shall be an outcome-based approach grounded in the needs of local healthcare industry by 100%. Utilize innovative technologies to upgrade the existing classroom and laboratories by at least 60%. Improve institutional bar exam performance of students to at least 10% above the national passing rate. All the faculty members will attend industry and education-related seminar training for at least one national or provincial level annually. 100% of the faculty members who are teaching professional and core subjects will be a master's degree holder, and at least 50% of the faculty is a holder of doctoral degree. To increase involvement of students to in-service learning activities, to increase social responsibility and civic engagement. Submit the BS in midwifery for program accreditation, at least level 1 in 2025 and level 2 in 2030. Apply for ladderization of the BS in midwifery program to increase competence of graduates. In terms of extension, the Health Science Department targets to deliver basic health services to community through Adapt a Barangay and School program. Improve community health status through intensifying health education and environment sanitation programs. Establish linkages with partner agencies and industries for funding and support. Along research, the Health Science Department also aims to conduct at least one funded research activity annually focusing on improving teaching-learning process, maternal and newborn care. Conduct at least one interdisciplinary collaborative research annually. Imbibe the culture of research to students and faculty by implementing a research mentoring program and conducting an annual department research conference. Lastly, the Health Science Department aspires to establish a sustainable production activities and projects at least one student-led and one faculty-led.
At this point, may we present also the Health Science Department faculty and institution's key personnel by Mr. Paul Mark Pilar, our Assistant Health Science Department Head.
Ladies and gentlemen, I present to you the ISCC Administrative Officials and Staff. Our College Administrator and the Board of Trustees Vice Chairman, Dr. Arnel Castro Doctolero. Our Assistant College Department Head, Mr. Amador P. Rojo. Our ISCC College Secretary and the Board of Trustees Secretary, Mr. James R. Taiza. I present to you the different unit heads of the different administrative offices. Dr. Cesar Solier, the Director of the ISCC Demo Farm Campus. Mr. Amador P. Rojo, the Coordinator of the ISCC TESTA Programs. Under the ISCC TESTA Programs Office, we have Mr. Benjo M. Kidulit, the Focal Person and the CAC Processing Officer and Computer Operator. We have Mrs. Joan Maria S. Guzman, the Assistant Focal Person and the CAC Liaison Officer. And we have Mrs. Marisol Arfahel, the CAC Cashier. From the Registrar's Office, I present to you Mrs. Angela C. Alcantara, our College Registrar. We have the staff of the Registrar's Office, Mrs. Marianne Chu, Mrs. Madeline Ascueta, Mrs. Ana Raquel Pilar, and Mrs. Corona Ayunol. Under the Human Resources Office, we have Ms. Karen Disingson, our Human Resource Officer, Ms. Elizabeth Ragini, our Assistant Human Resource Officer, Ms. Lizelle Kabagungan, our Record Officer, and Ms. Digna Jane Riva, our Liaison Officer. I also present to you Ms. Jessa May Salvio, our Finance Officer, Mrs. Maricel Fahel, the Accounting Clerk, Mrs. Judeline Altares, the Admin Secretariat, and Ms. Digna Jane Riva, the Liaison Officer. I also present to you our Production Coordinator, Mr. Eric Bumanglag, and our Instruction Coordinator, Dr. Cheryl Pilita T. Dolorico. For the Management Information Systems Office, we have Mr. Marie Louis Abraham Paz, the MIS Officer, and his staff, Mr. Benedict Toricer, Mr. Alfie Rapisura, and Mr. Mac Robinson Regusera. For the Quality Assurance and Planning Office, we have Mr. Paul Mark P. Pilar, the Quality Assurance Coordinator and College Planning Officer, and Mrs. Marie Cecil Liberty S. Varilla, the Quality Assurance Co-Coordinator. Under the Research Office, we have Dr. Jeff Lay T. Rebron, our Research Coordinator, and Ms. Cheryl Ann M. Almare, our College Statistician. For the Extension Office, we have Mr. Bert Kian Q. Pograd, the Extension Coordinator, and Ms. Lovely Ann Cardona, the Secretary. For the Office of Student Affairs and Services, we have Mr. Rodney A. Quisada, the Coordinator, and Mrs. Buena Griselda R. Taloza, the Co-Coordinator. Under the Student Affairs and Services, we have Ms. Jeanette T. Torrisen, the Advisor of the Central Student Organization, and Mr. Benjo M. Kidulit, the Co-Advisor of the Central Student Organization. For the Guidance Office, we have Mr. Brian Q. Cabico, the Guidance Counselor, and Mrs. Sheila Rabanal, the Psychometrician. We also have Ms. Lloyd Vivian Domingo, our Scholarship Program Coordinator, and Ms. Joanna Seguritan, the Sports Development Coordinator. For the Culture and the Arts, we have Mr. Sherwin N. Ugalde, the Program Coordinator, and for your health-related concerns, we have Maria Michelle L. Riglos, our School Nurse. For the School Publication, we have Ms. Joanna Ann Patubo as the Advisor, and Mrs. Denise C. Tronco as the Co-Advisor. Still under the Student Affairs and Services, we have Mr. Lawrence Christian Dacanay, the Coordinator for the NSTP and the Boy Scouts of the Philippines. We also have Ms. Donalyn Carino, the Co-Coordinator for the NSTP and the Coordinator of the Girl Scouts of the Philippines. For the Library Services, we have Mrs. Juby L. Pangan, our College Librarian. We have Mrs. Maritoni Pertudo, our Assistant Librarian. And we have Mrs. Jean Madriaga, our Assistant Librarian. Without further ado, it is my honor to present to you the Faculty of the Health Science, Mr. Limuel V. Dolorico, the Health Science Department Head and the Midwifery Principal, Mr. Paul Mark Pipilar, the Assistant Health Science Department Head, Mr. James R. Liza, Mrs. Marie Cecil Liberty S. Varilla, the Health Science Department Quality Assurance Coordinator, Dr. Jeff Lay T. Reboron, the Health Science Department Publication Coordinator, Mr. Bert Kian Q. Pograd, the Health Science Department Student Development Coordinator, Mrs. Maria Michelle L. Riglos, the Health Science Department Production Coordinator, Mrs. Sharon M. Rabacal, Mrs. Emily A. Cachola, the Health Science Department Production Co-Coordinator, Mrs. Joy Reyna Ragasa, the Health Science Department Research Coordinator, Ms. Jeanette Toricer, the Clinical Coordinator, Ms. Krista May Taboyo, the Department Laboratory Custodian, and Mr. Jerly Redoble, the Health Science Department Extension Coordinator.
At this point, the different instructional delivery will be discussed to us by Dr. Jeffley Reboron, the Health Science Department Publication Coordinator and the Research Coordinator of ISCC.
Magandang araw sa inyong lahat and welcome to Ilocos Community College Health Science Department. My name is Dr. Jeffley Taay Reboron and I am tasked to orient you with the teaching modalities that we will be adopting in our academic units for the school year 2021 to 2022. And regardless if you are a Bachelor of Science in Midwifery student or a caregiving student or a healthcare assistantship student, please bear in mind that these learning modalities will always apply to you. The COVID-19 pandemic has drastically affected the way we teach our students. Because of the dangers of being infected by the coronavirus, we can no longer continue with our face-to-face classes. You have to remember that your safety is our priority. But just because we can't conduct our face-to-face classes doesn't mean that education and learning has to stop. Hindi po pwede na tumigil tayo sa pag-aaral at pagtuturo. In the Health Science Department, we aim to promote holistic student development, and we want our students to not only become knowledgeable and skillful healthcare professionals, but we also want them to become midwives, caregivers, and healthcare assistants who are passionate and respectful in their delivery of healthcare services. In accordance to the IATF health and safety protocols, we will be delivering our lessons to you through the help of educational technologies. You will be needing your mobile phones and other smart devices to connect to the internet so that you can remain updated with the lessons and activities. Aside from that, we will also be giving you different offline assignments and requirements that can help you augment and improve your learning experience in our different programs. And so, I will be orienting you with the different teaching delivery plans of the Health Science Department, including mobile learning, blended learning, online kamustahan, student progress report, and group chats and phone directories. As mentioned earlier, the Health Science Department will be integrating flexible learning approach for this school year, and that will include mobile learning and blended learning. This is to ensure that we can still continue providing quality health science education even if our students are learning remotely. When we talk about mobile learning, this is a learning approach wherein your mobile phones will play an integral role in your education because it will be used as a tool to deliver learning, and it will also be used to assess how well you have learned in your classes. And since we are already in the topic of mobile learning, please bear in mind that we will only be using specific phone applications and programs to deliver the topic and to conduct our classes. So, I urge you to start downloading these mobile applications onto your mobile phones before the start of the classes so that you will have more time to be familiarized with the interface of the said applications. And so, here are the following platforms for your mobile learning that you should download on your smartphones. Number 1 on the list is Google Classroom. This platform will be used to distribute the learning packets or what we call modules, and we will also be using it to submit your requirements, quizzes, and activities. Please remember to create your Google account and use your real name when you register to your Google Classrooms. Links to the different subjects will be sent by your advisors. The next mobile application that you should download is Google Meet. The Google Meet platform will be used to conduct your virtual classes and online kamustahan as part of our synchronous delivery of learning. Be sure to have your own headsets with you when you join this virtual meeting so that you can properly hear what your teachers are saying during your classes. Schedules for Google Meet classes will be posted to your group chats beforehand. Another application that you should download is YouTube. For those students who have intermittent internet connection or yung mga paputol-putol ang internet, you can still view and watch the class by visiting our official YouTube channel, ISCC Health Science Department. You can download the different classes and pre-recorded lectures once you have access to the internet. So, download YouTube now. We will also be implementing blended learning, wherein our delivery of instruction will either be synchronous or asynchronous. When we talk about blended learning, there will be instances wherein you will be virtually meeting with your instructors at a given time, and there will also be times wherein your instructors will not meet you virtually but will only give you activities and requirements to complete during that day. This means that you will only have to do self-study and that we are expecting you to do your roles and responsibilities as a student. Now let us differentiate synchronous classes from asynchronous classes. When we talk about synchronous classes, these are held for students who have fast and reliable internet connection or those who can join the virtual classes in real time. During synchronous meetings, the teacher will connect with the students using Google Meet, which will be shared on your group chats a few hours prior to the meeting. The teacher during synchronous classes can either conduct the class virtually or do informal discussions and conduct the online kamustahan. Please bear in mind that all the Google meetings will be recorded and uploaded online. But when we speak of asynchronous classes, the students will be given tasks to complete or perform without having to meet with their teachers. The students can log on to their group chats or Google Classrooms to view the tasks, activities, or requirements that are expected of them to complete during that day. Activities like watching supplementary videos, reading course packets or modules, taking quizzes, or doing virtual recitations via group chats may be done as part of asynchronous classes. Now let me remind you that all learning packets or modules will be distributed every first week of the month and they will only be uploaded in your Google Classrooms. We will no longer be distributing printed copies of your modules in support of the provincial government's aim to decrease the COVID-19 cases. Another thing that you need to know in the Health Science Department is that we are conducting online kamustahan. We know for a fact that learning and studying during this time of the pandemic may become physically stressful, mentally draining, and emotionally exhausting. For these reasons, we will be conducting an online kamustahan every 2 weeks which will last approximately 30 minutes. During our online kamustahan, the teacher will do mental health checks, ask you how you are doing, and ask about your different concerns and issues. Please take this opportunity to communicate with your teachers so that they can help you address your problems and concerns. Here in ISCC, we want to prevent you from suffering from too much stress and burnout. That is why we are giving you this opportunity to talk to your advisors and teachers regularly. We will also use this online kamustahan as a channel to monitor your academic growth and reinforce salient points in your courses and celebrate your progress and your small victories. We will also be doing students' progress report to you and your parents. This means that we will be sending quick reminders and progress reports via private message. Your instructors and advisors will send you a private message informing you of the quizzes that you still have not yet taken and remind you of the different requirements, tasks, and other activities that you have not yet completed. Your academic progress means the world to us, and we will try our very best to monitor your progress and keep you informed of your deficiencies and lackings so that you can immediately address them. Lastly, your advisors will be adding you to the different group chats for all your subjects this semester. You will have separate group chats for all of your core, major, and minor subjects. Please refer to your enrollment form and ensure that you have been added to all of your group chats for all of your subjects. You can contact your advisors for technical help and assistance. We will be using the Facebook Messenger application to communicate with you. Your parents and your guardians will also be added to a separate group chat so that we can communicate with them easily if ever we have special concerns and announcements. Please remind your parents and guardians that they can also use these group chats to raise their questions and concerns. We will try our best to address their problems immediately. On your first meeting, you will also be asked to provide your cell phone numbers along with the name and contact detail of your parents and guardians. We will be creating a phone directory so that we can reach you and your relatives immediately, especially during urgent situations. Before I finally say goodbye, let's have a review of the teaching delivery strategies of the Health Science Department for the school year 2021 to 2022. Number 1, we will be using mobile applications such as Google Classroom, Facebook Messenger, Google Meet, and YouTube to deliver learning to our students. Number 2, we will also be using blended learning approach wherein the students will join synchronous classes and asynchronous sessions. Number 3, once every 2 weeks, there will be an online kamustahan to check on your mental health and your academic progress. Number 4, progress reports will also be sent to you using private messages to remind you of your lackings and your deficiencies. Number 5, lastly, we will communicate with you and your parents and guardians through Facebook Messenger group chats, calls, or SMS. So please provide us of their contact details. And that ends my slides. With that being said, maraming salamat for listening, and we look forward to providing you with excellent health science education here in ISCC. This has been Dr. Jeffrey Reboron, and I welcome you with open arms to the Health Science Department.
May we also know the students' decorum, which is to be presented by Mr. Bert Kian Pugrad, the Student Development Coordinator of the department.
Good day to all. Welcome to Ilocos Community College Health Science Department Orientation Program. I hope you are all doing great. I am Bert Kian Pugrad, and today I am tasked to present the details that you need to follow as per student decorum. What is decorum? Decorum pertains to the appropriate behaviors, desirable conduct, and etiquette. In both clinical and classroom setting, students must always respect the confidentiality of their clients' information and practices, respect their preceptors in their clinical area, the faculty and staff in the institution, as well as their fellow students. Obscene or vulgar language are unacceptable. Students are expected to be courteous, professional, presentable, and must follow the institutional policy at all times. Guidelines for the administration of student discipline. Disciplinary action shall be handled by the department and the guidance office. Cases beyond the capacity of the aforementioned offices shall be referred to the appropriate agency or institution. For the offense dishonesty, like for example, lying, giving false information, cheating or online cheating, academic dishonesty like plagiarism or copying one's output, or you're submitting a copy-paste output, the disciplinary actions are the following. For the first offense, reprimand, letter of an explanation, promissory note, and demerit. For second offense, demerit, and community service for about 3 to 6 hours. For the third offense, you may be recommended for expulsion. For discourtesy, or giving a demeaning statement to faculty and students, for first offense, reprimand, letter of explanation, and promissory note. For second offense, demerit and community service for 3 to 6 hours. For third offense, you may be again recommended for expulsion. Other example of discourtesy, lack of respect and refusal to obey valid orders given by the teachers, superiors, and the institutional staff. First offense, reprimand, letter of explanation, and promissory note. Second offense, demerit and community service for 3 to 6 hours. And third offense, recommended for expulsion. Another example of discourtesy, disrespectfully answering back your superiors or instructors. For the first offense, reprimand, letter of explanation, and promissory note. For second offense, demerit and community service for 3 to 6 hours. And third offense, recommended for expulsion. And the last, we have non-adherence to duty schedules and disrespecting patients or classmates. For the first offense, reprimand, letter of explanation, and promissory note. For second offense, demerit and community service for about 3 to 6 hours. And for third offense, recommended for expulsion. For loitering, like for example, receiving or entertaining visitors without the permission of the supervisors or your clinical instructors. Take note, during your clinical duty, you are not allowed to entertain any visitors unless for emergency reasons. For the first offense, reprimand, letter of explanation, and promissory note. For second offense, demerit and community service for 3 to 6 hours. And for third offense, you may be recommended for expulsion. For loitering, like for example, entering or staying in a vacant room or an unoccupied room, or loafing from one unit to another, or avoiding tasks given during your clinical or your community duty, the disciplinary actions are the following. For the first offense, reprimand, letter of explanation, and promissory note. For second offense, call parents, demerit, community service of not less than 3 hours, but not more than 6 hours. And for the third offense, you may be recommended for expulsion. Next is defamation. Defamation against fellow students, faculty, other team members, and other institutional staff. When we say defamation, these are your paninirang puri in Filipino or Tagalog, in Ilocano or Iloco, mangperditi tao. So in defamation, we have your two forms or two types. We have your verbal and your written defamation. Example of your written defamation, we have your posting in your social media accounts against a person, your instructor, or your classmate, the institution, or the hospital staff. The disciplinary actions for defamation are the following. We have, for the first offense, reprimand, letter of explanation, and promissory note. For second offense, call parents and demerit. And for a third offense, you may be recommended for expulsion. Reporting for duty under the influence of dangerous drugs or prohibited drugs and alcohol. Take note, bawal pong mag-duty under the influence of alcohol or even under the influence of the prohibited drugs, because your actions or your decisions might pose grave threat or risk to your patients. The disciplinary actions are the following. First offense, letter of explanation, promissory note, and counseling. For second offense, call parents and referral to appropriate authority. For third offense, you may be recommended for expulsion. Smoking within the school premises and duty premises, whether hospital, community, or in the home for the aged. Take note, bawal pong kumithit ng UC because when taking care of your patients might inhale the smoke and might trigger their respiratory problems. For the first offense, reprimand, letter of explanation, and promissory note as well as demerit. For second offense, demerit and community service for 3 to 6 hours. For the third offense, you may be recommended for expulsion. Next, we have possession of deadly weapons such as knife, firearms, ice pick, and the like. For the first offense, reprimand, letter of explanation, promissory note, counseling, and call parents. For the second offense, call parents and reporting to appropriate authority. For a third offense, you may be recommended for expulsion. For stealing, first offense, letter of explanation, promissory note, demerit, and counseling. For second offense, call parents and reporting to appropriate authority. For the third offense, recommended for expulsion. Vandalism. Since your education is funded by the state, you should learn how to take good care with our school facilities. For the first offense, reprimand, letter of explanation, promissory note, and demerit. For second offense, community service for 3 to 6 hours. For the third offense, you may be recommended for expulsion. Forging signature. First offense, letter of explanation, promissory note, and counseling. Second offense, call parents. And third offense, you may be recommended for expulsion. In the last, we have your falsification of school documents. First offense, letter of explanation, promissory note, and counseling. Second offense, call parents. Third offense, you may be recommended for expulsion. I'll be now presenting the guidelines on investigation of an offense and filing of complaints. I'll be discussing the procedures in the investigation of an offense and procedure for filing a complaint. Procedure for reporting complaints. Student to instructor. The student is required to submit a complaint letter addressed to the principal for investigation. Student to student. The student complainant is required to submit a letter addressed to the advisor for investigation. Instructor versus student. The instructor is required to submit a complaint letter addressed to the principal for investigation. Procedures in the investigation of an offense. The witness or complainant is required to submit a letter to the class advisor charging the accused within 24 to 48 hours after the incident. The class advisor shall elevate the complaint to the principal or head of the department. The principal or head of the department will require the accused student to write a letter stating his or her position to the alleged offense. The case shall be referred to the guidance for joint investigation. If the student is found guilty, appropriate sanctions will be applied depending on the severity of the offense. The decision shall be based on the agreement between the department and the guidance office. If the accused student is proven innocent, the case will be closed and all records relevant to the case will be destroyed. The student will be allowed to continue attending classes and duty and will make up for the absences incurred during the suspension. Since we'll be adopting a virtual setup, rules of netiquette are necessary. Number 1. Be human. Be respectful to your fellow student and instructor when meeting in a virtual space. Number 2. Know when you're in the digital space. Be sure that your background don't have any disruptive stimuli that might affect your communication or presentation during class. Be sure that you are also well-dressed when attending in a virtual meeting. Third rule, online life and real life. Follow the rules and be ethical. Fourth, respect time and bandwidth. Be sure that you respect the personal time of your instructors and avoid sending messages beyond their official time. During virtual class, you may open your camera or close your camera to conserve the bandwidth. Fifth rule, make yourself good online. Be prepared and be presentable when presenting online. 6. Share expert knowledge. Feel free to participate in synchronous and asynchronous online discussions to make your learning session productive. 7. Check your opinions and emotions. In an online discussion, be sure to argue with your ideas or with ideas and facts and not personally attacking the people. Number 8. Respect others' privacy. Do not just copy and paste materials. Learn to rephrase, paraphrase, summarize, and synthesize. But please do not forget to give credits to your sources. 9. Do not abuse power. And the 10th rule, forgive mistakes and be kind. Few tips in sending messages to your instructors. First and foremost, check the time. Be sure that it is their scheduled consultation day and time, or usually within their office hours. Second, start with a greeting and be courteous. Introduce yourself, your program, and your year level. State the purpose of your message. Ask for clarifications, and do not forget to end the conversation with gratitude. In sending an email to your instructors, do not forget the following. Number 1, subject line. Provide 2 to 5 word summary of the email. Second, begin with a greeting. Third, the body of an email. State your reasons or your clarification to your instructor. Fifth, closing. Always end any forms of mail with a gratitude. And do not forget to sign your name or to state your complete name. Other general tips: be sure to use proper capitalization and punctuation. Always use proper grammar, and please spell out your words correctly. Thank you very much for listening, and I'm so excited to see you all virtually.
The next presentation will be the retention policy, which will be discussed and presented by Ms. Marie Cecil Liberty Varilla, the Quality Assurance Co-Coordinator.
Greetings to everyone. I am Marie Cecil Liberty Varilla, and I will be presenting to you the retention policy for the department. This retention policy encompasses circumstances that serves as our basis whether to promote a student into the next year level or not. Okay, so let us begin. So what are the circumstances that are found in our retention policy? First, if a student fails in any clinical practicum courses but is able to pass the professional subjects enrolled during the same term, he or she will repeat the clinical practicum course but not the professional subject. Okay, so what are these clinical practicum courses that is mentioned in these circumstances? So these clinical practicum courses are the related learning experiences or your duties wherein you will be rotated into the different healthcare agencies or health facilities in our province that our school is affiliated to. Okay, so if you failed in these courses or in the CP or the clinical practicum courses, but you passed the professional subjects, okay, you will only be required to re-enroll or repeat at that certain clinical practicum course. Next, a student must not have 3 failing marks in a semester. Otherwise, the student will not be allowed to continue with the program. So, most specifically for major or the core subjects. So, if you acquired 3 failing marks in a semester, you will not be allowed to continue with the program any longer. Another one, a student who has incomplete grades or drop in any of his or her enrolled course or courses may still be allowed to continue, depending on the merit of each case. Okay, so for the reason of acquiring an incomplete or a drop mark, okay, was not as grave as a ground for expulsion, that student is still allowed to continue to the next semester, provided that for the incomplete grades or the drop, for the incomplete grades, that student will be able to complete the requirements within 1 semester. Okay, so right after the semester wherein he incur an incomplete grade, she or he must complete the requirements. Okay, otherwise he or she will be marked failed. Okay, next, the student must be able to attend at least 80% of the required individual credit hours for the classroom and in the clinical practicum courses. Student who will incur 20% or more absences of the total number of credit hours per course will automatically be dropped or failed regardless of the academic performance. Okay, so for example, for the clinical practicum courses like the CP100, which is a 3-unit course, and in every unit, okay, it is composed of 51 hours. So the total meeting hours for this course will be 153. Bakit po? We have 3 units times 51 hours per unit is equivalent to 153 hours. So the total number of hours for this course will be 153 hours. Now, if you incur 20% or more absences of the total number of hours, you will be marked failed or dropped. Okay, so for the 20%, okay, of this 153 hours will be 30 hours. Okay, so if you will be or if we will be having a meeting of 6 hours per week, then 5 absences will automatically fail you from this course. Okay, so that is the 20% of the total number of credit hours per course. Next, previously disqualified students are barred from readmission to the midwifery program. So if a student who violated a rule which resulted to expulsion, okay, syempre they will not be readmitted into the program. Another one, if a student fails to complete or pass any of the professional subjects per term, the student will not be allowed to enroll the succeeding major and professional subjects. So what are these professional subjects? Okay, so for the first semester, first year, first semester, we have the foundations of midwifery practice or the M100. And then the second semester, we have the normal OB and immediate newborn care or the M101. And then for the second year, first semester, we have pathologic OB or the M102. And then for second semester, we have M103 or the professional growth and development. So if you failed in any of these professional subjects, you will not be allowed to enroll the succeeding major and professional subjects. Most specifically, these subjects has a prerequisite subjects. Ibig sabihin po, when we say prerequisites, you have to complete first a certain subject before you can enroll these subjects. Next, transferees who have failing marks of the major or core and professional subjects are not allowed to enroll in the midwifery program. Okay, so if you acquired a failing marks for the major or core subjects and the professional subject from the previous school that you have enrolled to, okay, we're very sorry, but you will not be allowed to or you will not be admitted into the midwifery program. Next, transferees who have incomplete grades are required to present a proof of completion of grades from his or her previous school. So if you are transferring to ISCC and you have an incomplete grade from the recent school that you were enrolled to, okay, you have to at least present to us a completion form, okay, as a proof or as an evidence that you have already settled your grades, okay, before you will be allowed to enroll into the midwifery program. Student who failed in 3 minor subjects and 1 major subject is no longer allowed to continue with the program. So kung kanina po, if you failed in 3 major subjects, you will not be allowed to continue anymore into the program. This time, if you failed or if you incur 3 failing marks in 3 minor subjects plus 1 major or professional subject, you will no longer be allowed to continue with the midwifery program. Okay, so another one, the general weighted average of core subjects and professional subjects will be evaluated in order to be promoted into the next level. Okay, so hindi po pwedeng pasang-awa ka lang. So you have to meet a general weighted average in order for you to be promoted into the next level. Okay, so the required average are as follows. Okay, so to be admitted into the second level, a student must have at least 80% general weighted average for the core and professional subject. Okay, again, to be admitted into the third level, the student must at least have an 83% of the general weighted average for the core and professional subjects from the grades in his or her first and second level. So, ipo-compute po yung grades mo for the professional and the core subjects during your first year and in your second level. And you must have to have an 83% general weighted average in order for you to be admitted into the third level. Next, fourth level. O, nakapasa ka na po sa third level and then you're already going to the next level or to the last level of your midwifery program. Okay, so the student must have at least 85% of the general weighted average computed from the grades in first year, second year, and third level. Okay, so you have to remember to be admitted into the second level during your first year. You must have a general weighted average for professional and core subjects of 80%. Okay, and then to be admitted into the third level, the general weighted average from first year and second level should be 83%. And to be admitted to the last level or the fourth level, okay, the student or you must have 85% of the general weighted average of your professional and core subjects from your first, second, and third level. On pregnancy, so this one is also an important information for everybody. What if a student will get pregnant during the semester? Or what if a student plans to enroll into the midwifery program but she is pregnant? Will she be allowed to enroll or will she be allowed to continue? Okay, so let us see. A pregnant student shall not be allowed to enroll in any of the clinical practicum courses. Okay, so if the student is pregnant, okay, before enrollment, she will not be allowed to enroll clinical practicum courses or she will not be allowed to have her duty. Bakit po? Okay, so when you will be rotated into different healthcare facilities, the risk of exposure to infectious diseases is at most, and it could affect the safety or the health of the unborn child. So you will not be allowed, or the student who is pregnant will not be allowed to enroll clinical practicum courses. Or if this student gets pregnant during the semester, she will be required to drop the clinical practicum courses and other major subjects as deemed necessary. Again, that is to ensure the safety of the unborn child as well as the student. Okay. Furthermore, the student is required to submit the following documents. Okay, so a pregnant student must submit a medical certificate from the obstetrician that she is physically fit to continue to attend to other enrolled courses. Okay, so this student who gets pregnant is still allowed to continue with the midwifery program. Okay, yung hindi lang po pwede is the clinical practicum, or he or she is not just allowed to have her duty or the related learning experiences. Okay, but before continuing into the midwifery program, this student must furnish to the office a medical certificate from her obstetrician certifying her that she is physically fit, okay, to attend other classes. Okay, aside from the medical certificate, she is also required to sign a waiver releasing the school of any responsibility for any untoward incidents that may happen during the course of her pregnancy. Okay, so that ends up my presentation. Thank you for listening.
And the last, but definitely not the least, will be the presentation of the clinical practicum policy and the case requirement, which is to be presented by Ms. Jeanette Toriser, our clinical coordinator.
Good day to each and everyone. This is your Ma'am Jeanette Toriser, and I will discuss to you about the clinical practicum or the clinical duty. A clinical practicum is the application of the principles and theories of midwifery practice. The students are expected to apply their skills and knowledge that they develop during their lecture. It is composed of 2,346 hours of related learning experience in the laboratory, clinical, and community areas. Clinical rotation plans or schedule will be prepared prior to the start of clinical duties per term to serve as a guide for students and clinical instructors. The students will be supervised by the clinical instructor, which is a faculty member of the Health Science Department and will serve as the preceptor in clinical area and community. All students are required to undergo clinical and institutional orientation prior to the start of clinical practicum. So you will have your orientation in the school and in the hospital. If the student fails to attend the orientation, he or she will not be allowed to attend the clinical duty. So the students are expected to be courteous, professional, presentable, and follow agency policy at all times. The students are expected to abide by the rules and regulations during their clinical tour of duty. Regarding the tardiness, the student shall report to the clinical area and his or her clinical instructor 30 minutes prior to the start of the scheduled time and required to log in their time of arrival at the CI's or the agency's logbook every scheduled duty. Students are only allowed to incur 15 minutes late from the scheduled time. Beyond 15 minutes, the student is no longer allowed to enter the clinical area and marked as an excused absent. Students who have accumulated 30 minutes of tardiness, regardless of the clinical area, are required to have their makeup duties at 1:3 ratio. Similarly, if the clinical instructor is not around in a clinical area within 15 minutes after the scheduled time, the students must inform the clinical coordinator or midwifery principal. In terms of absences, students who incur more than 20% of the total number of hours of clinical practicum during the semester will be automatically be dropped and required to re-enroll the said clinical practicum. One unexcused absence corresponds to 3 makeup duties, which will be held at the end of the semester. If a student is unable to go for his or her scheduled duty due to a medical condition or any emergency, he or she is required to present his or her medical certificate and excuse letter for the following day or as soon as conditions permit. Said documents should be duly signed by a physician and their parents or guardian respectively. If the reason of the student's absence is considered valid or excused, he or she is required to attend a makeup duty with 1:1 ratio. So this means that every one excused absence corresponds to 1 makeup duty only. Students who have 3 consecutive unexcused absences shall be automatically be dropped. For the grooming and uniform, for females, hairnets should be worn properly. Loose hairs must be tucked inside the hairnets and hair should not touch the collar of the uniform. For males, hair should be clean cut and should not touch the ears and collars of the uniform. Wear only black colored hair accessories like ponytails and clips. Nails should be neatly trimmed and colored nail polish is not allowed. You are only allowed to wear wristwatch with second hand. However, for married students, wedding rings are allowed except in special areas like the operating room and delivery room. Students are required to strictly wear the prescribed uniform. In the clinical areas, the students are only allowed to wear white shoes for both male and female, and white stockings for female. For males, plain white v-neck t-shirt is worn as undershirt and should be properly tucked inside the pants. Wear only white, black, or skin tone undergarments or underwear. And always use your nameplates, which will be provided by the department. And for females, aprons should only be worn inside the clinical area. Each student is expected to bring his or her paraphernalia for duty as required per clinical area. Failure to bring the following items corresponds to a certain demerit or punishment depending on the clinical instructor. The students must ensure that all his or her equipment are in optimum working condition to ensure delivery of safe and quality care. So these are the complete set of clinical paraphernalia: bandage scissor, prescribed color of pen, small notebook, sterile gloves, alcohol, 6-inch ruler, pen light, pencil, cotton balls, watch with second hand, BP apparatus, stethoscope, digital thermometer, tape measure, and record of delivery cases. In the community area, prescribed community uniform must be followed: white top and green pants, black leather shoes and black socks, nameplate, a complete set of OB bag or PHN bag, and in addition to the prescribed paraphernalia, the students are required to bring extra clothes, slippers, and umbrella. For the special area, aside from the paraphernalia mentioned earlier, students assigned in the operating room and delivery rooms must bring with them the following: official scrub suits, face mask, bonnet with embroidered surname and the initial of the first name of the student, sterile gloves, lab gown, and clean slippers. The wearing of the scrub suits outside of the special areas are strictly prohibited during the tour of duty. Students are obliged to follow institutional policies with regards to the dress code in the special areas. The use of cell phones, cameras, and tape recorders are not allowed in the clinical area except for learning purposes with prior permission from the preceptor or the clinical instructor and the senior staff on duty. Such devices should be kept in the student's room or by the clinical instructor for safekeeping and shall only be returned during breaks and after the clinical duty. Taking pictures within the clinical area are strictly prohibited. Similarly, uploading pictures taken during the clinical practicum in any social media platform is prohibited. Violations to the aforementioned policies will be dealt accordingly. Other concerns: the students are not allowed to receive and entertain visitors during regular duties and on call. Students are not allowed to wander or loiter around the institution or venture out of the premises without permission from the clinical instructor. Unauthorized entry to any vacant rooms in the hospital is strictly prohibited. Gambling and smoking are strictly prohibited within the premises and in the immediate area of the affiliating institution, even during break time. Alcohol, weapons, and other illegal or regulated items and substances are not allowed in the clinical areas. At the same time, students who are caught under the influence of such substances shall be dealt with accordingly. Making of unnecessary noises is strictly prohibited. You are not allowed to eat inside the ward or in the nurse station. Private vehicles are not allowed to be used when having clinical practicum in the community. A transport vehicle will be arranged by the clinical instructor and students will have to pay for the corresponding transportation fee. Ask permission when leaving in the area of assignment, and students are only allowed to have a 15-minute break for snacks and 30 minutes for meals. In cases of emergency, notify and ask permission from the clinical instructor. Relationships with other students, clinical instructors, and staff should be maintained at a professional level. Aside from the regular duty, the students are required to have their on-call duty without the supervision of the clinical instructor to help them complete their delivery cases, so they will be supervised by the staff in the hospital. For the on-call duty, students who are willing to have their duty should submit 2 copies of duly accomplished on-call duty form to the midwifery principal. 2 copies of duly signed on-call duty form should be forwarded to the chosen facility or hospital at least 24 hours prior to the scheduled on-call duty or according to agency policy. The receiving copy of the on-call duty form should be presented to the midwifery principal for confirmation and documentation. During the scheduled date of on-call duty, the student should bring the receiving copy of the on-call duty form and present it to the chief nurse or senior nurse or midwife on duty and should be submitted to the midwifery principal as soon as possible. Bring with you copies of the labor and delivery room student record with partograph, which will be provided by the department, and accomplish it accordingly. Students are expected to report at least 15 minutes before the scheduled time of duty and are not allowed to go out earlier before the end of their scheduled duty. The students should report on their on-call duty in their prescribed uniform per agency policy. Students are not allowed to wear their scrub suits and lab gowns while on transit or in going to the affiliating institution. Students should follow agency policy regarding the wearing of scrub suits and lab gowns. The students are expected to be presentable and follow agency policy at all times. The students are required to log in their time of arrival or the agency logbook. Cell phones and other gadgets are regulated in the different clinical areas. Use of such devices are allowed only for emergencies. In case of emergency, notify and ask permission from the agency staff on duty. Alcohol, weapons, and other illegal or regulated items and substances are not allowed in the clinical areas. At the same time, students who are caught under the influence of such substances shall be dealt with accordingly. Students are not allowed to wander or loiter around the institution or venture out of the premises without the permission from the staff. Students are not allowed to entertain any visitors for the duration of the on-call duty. Each student is expected to bring his or her own paraphernalia for duty as required per clinical area. This includes a surgical mask, bonnet, and surgical gloves. The student must ensure that all his or her equipment are in optimum working condition to ensure delivery of safe and quality care. Students are expected to act and behave appropriately. This includes being sensitive to the needs of the patients and the staff. Students are required to help prepare and clean the delivery room before and after delivery and are expected to monitor clients as dictated by the client's condition. Non-appearance during the approved on-call duty without any valid reason means denial of future requests for on-call duties. For the clinical safety of the students, they are required to follow and observe the standards of providing care, including infection control measures like hand washing. Always observe standard precautions like using personal protective equipment in all client contacts and avoid direct contact with blood and body fluids. Students are advised to receive and complete a hepatitis B vaccination to protect them from the disease. If the students feel that they are incapable of functioning in a safe and competent manner because of lack of sleep, they must notify the preceptor or the clinical instructor to discuss what remedial action should be taken. Students should be aware of their surroundings while attending to their regular and on-call duties. The student must take appropriate measures to ensure personal safety. All accidents or injuries incurred by the students while on their regular and on-call duties, whether at the clinical or community area, or while traveling to or from the clinical and community areas must be reported to the preceptor or the clinical instructor during regular duties and the senior on duty in the clinical area during on-call duties to determine the appropriate action or response to be undertaken. As the World Health Organization declared the 2019 coronavirus disease as a global health crisis that led to the disruption of almost everything, some work has been stopped, class has been suspended, and everyone are advised to stay in the protection of their homes. Although flexible learning has been the best choice, as it is the safest way to reach the learners, face-to-face delivery for some courses is necessary, especially health-related courses as they are trained to handle lives. In connection to this event, there is a need for the institution to plan measures to prevent their students, faculty, and staff from getting infected from the disease in compliance to the IATF minimum public health standards and protocols of DOH, policies and guidelines, advisories of CHED, health and safety protocol of the province and concerned LGUs, and the policies of the relevant affiliated health agencies. These are the requirements for the clinical practicum. The clinical instructor and affiliating student coming from outside of the province shall present a negative RT-PCR test result or negative antigen test upon entry to the province as reflected on the COVID-19 protocol of Ilocos. The clinical instructor and affiliating student shall submit a certificate of non-exposure to COVID-19 from the barangay captain of their respective residence. Clinical instructor and affiliating student living with uniformed personnel outside the province shall indicate the nature of work, frequency of entrance and exit to the province, and the place of work of the applicant. The student shall participate in the virtual orientation in every clinical area. So the student shall present a waiver fully signed by their parents or guardians that they are allowing their sons and daughters to have their clinical experiences. Both the clinical instructor and affiliating student must sign an acknowledgement of risk form prior to the start of clinical exposure. Only clinical instructor with at least first dose of COVID-19 is allowed to follow up students in the clinical area. Students who receive COVID-19 vaccine shall be prioritized to undergo limited face-to-face internship. However, students who do not have vaccination because of valid circumstances such as no vaccine available or no vaccination schedule shall be allowed to attend the first rotation as a probationary period. The institutions shall forward a recommendation letter to their respective municipal health unit to facilitate vaccination of the students. For the screening and testing, the students shall accomplish the health declaration form before entry to the affiliating agency. The clinical instructor shall ensure that the students fully accomplish the health declaration form. But if the clinical instructor or affiliating student answers yes to any of the questions stated in the health declaration form, they are no longer allowed to have their clinical duty, so they must inform the school clinical coordinator about their case. The clinical instructors and affiliating students must screen themselves from the following daily symptoms of coronavirus disease prior to their exposure at the clinical area every duty days, making the CI in charge of assessing the students for their symptoms. The clinical instructor or affiliating student have a suspected or confirmed exposure or close contact to a COVID-19 positive individual, they shall not report to the clinical area. Instead, they must inform the RLE coordinator about their exposure for contact tracing. In case symptoms develop during the clinical day, the clinical instructor must inform the RLE coordinator and the hospital triage nurse for assessment. In case the clinical instructor or affiliating student has experienced symptoms pertaining to COVID-19 infection or has a known exposure to individual who is a COVID-19 positive, must also complete the hospital COVID-19 symptoms and exposure reporting. The clinical instructor and students shall undergo and submit antigen tests before they start and at the end of every rotation. The students are required to wear PPE or personal protective equipment to protect themselves and minimize exposure to hazards that cause serious injuries and illnesses. So wearing of face mask and face shield are required upon entry to the clinical area and should be worn at all times. All personal protective attire, like the face mask, face shield or goggles, bonnet, hazmat suit or coverall gown, gloves, and foot cover may be required depending on the cases of clients handled. The face mask shall be disposed in appropriate container and face shield shall be disinfected every after use. The scope of responsibility of the students during clinical practicum are as follows. Students shall only perform activities that are within the scope of the course description of the clinical practicum. Students shall not be allowed to perform procedures such as intubation, CPR, and handle cases involving respiratory problems. A clinical instructor shall supervise and assign tasks that are within the scope of course description. And the clinical instructor shall uphold and strictly implement the protocol within the whole duration of the clinical practicum. For the transportation and accommodation, the school shall arrange the transportation of the students and clinical instructor from the designated dormitory to the affiliating agency and vice versa. Students and the clinical instructor shall not be allowed to utilize other transportation vehicle aside from the vehicle arranged by the institution or by the school. In the event that the arranged vehicle cannot facilitate the transport, the students and clinical instructor can arrange a transport vehicle. However, they must follow the safety protocol or the use of PPE and obtain the personal information of the driver for contact tracing purposes. The institution shall arrange a dormitory for both students and clinical instructors for the whole duration of the clinical rotation. Students shall not be allowed to leave the dormitory within the duration of the practicum. In the event that the student is to leave the dormitory for valid reason, The clinical instructor and clinical coordinator shall coordinate to the health officer for proper action. Meals will be provided by institution. However, guardian or parent can still bring food to the students provided that there is proper coordination to the health safety officer. Cooking paraphernalia shall be provided if students are willing to cook their own meals. A specific route going to the dormitory shall be arranged to prevent unnecessary exposure. The students and clinical instructors are required to be quarantined every after clinical rotation. If they have a recent diagnosis of COVID-19, they must follow Provincial Action Center protocols, which includes the following: home quarantine for at least 14 days from the onset of symptoms, result of RT-PCR or antigen test, and medical certificate. In the event that the student or the clinical instructor has positive COVID-19 result, he or she shall be temporarily be quarantined in the school quarantine area, and the health officer of the institution shall coordinate with the municipal health unit for appropriate action. The clinical instructor and the student shall strictly follow the quarantine protocol of the institution. And after the rotation, both students and clinical instructors shall undergo a 14-day home quarantine for non-vaccinated students and 7 days for vaccinated students. Proper coordination to the LGU shall be facilitated. Every student must have a health insurance like PhilHealth or any similar insurance before the start of the clinical practicum. Students who are not qualified to avail a medical insurance, such as students below 18 years old or for any other reason, the student shall submit the medical insurance of his or her parent, where he or she is included as a beneficiary. Students who do not have medical insurance shall not be allowed to undergo the clinical practicum. For the schedule of the clinical practicum, each rotation shall be composed of not more than 6 students and 1 clinical instructor. Students shall strictly follow the groupings and schedule of the clinical rotation. Students shall not be allowed to transfer into group or other groups or schedule. If student want to change in the schedule, he or she shall inform the clinical instructor and the clinical coordinator. So the clinical coordinator shall decide regarding this matter. The rotation schedule shall be submitted and approved by the affiliating agency before the start of the clinical practicum. The students and clinical instructors must follow the social distancing protocol during the clinical practicum. They must abide by physical distancing of at least 1.5 meters at all times, except when conducting patient care activities which require closer physical proximity. The clinical instructor and affiliating students are not allowed to leave their respective area to take a break or buy food, and they are not allowed to entertain visitors or leave their respective area while on duty. For students to be included in the list of candidates for graduation, he or she must have satisfactorily passed all the prescribed academic requirements for the general education, professional, core, and clinical practicum subjects. Must have complied with the case requirements of the program. The student is required to submit a copy of record of cases to the school registrar and to the department head in the format provided by the PRC, including the proof of attendance to the required cases in the form of a duly accomplished case form sanctioned by the department. Moreover, students must be able to defend their cases before a validation committee. The case requirements are the following: 20 actual delivery cases, 20 internal examinations, 5 IV insertions, and 5 suturing of perineal lacerations. The case requirements for graduation will also be used to comply with the case requirements for the application of the midwifery licensure examination. For the students enrolled in the BS Midwifery program, they are required to assist 5 obstetric surgical procedures for mothers with obstetrical complications or emergency cases such as forceps delivery, vacuum delivery, and cesarean section. The students must secure and accomplish the clinical clearance provided by the department and must settle all accounts in the institution. That will be all for the clinical practicum. If you have any questions and clarifications, feel free to ask the instructors of the Health Science Department. Thank you so much and have a good day.
Let me end this presentation with a saying: we humans are resilient. We can learn to thrive in the new normal if only we have the mindset and the resources that we need to adapt. Once again, welcome to the Health Science Department, my dear students, and good luck for this school year 2021-2022. God bless us all.